and also ask to start video. Now, Torrin, can you hear me?
Yes, I can. Can you hear me?
Well, I can hear you. Fantastic. Now, I'm going to put us in speaker view. There we go, so we can all see you. Now, thank you so much for joining us today, Torrin. It's very much appreciated as part of our Are You OK Day community event. So the reason, or one of the main reasons that we were really, really keen to have you guys on board as part of today was because the emergency services play such a big part of mental health. And you guys deal with the very complex, severe range, of course. So we wanted to give people a lot more of an understanding about what it is that you guys do with regards to mental health, as well as when it's appropriate to call emergency services, what to expect, and also a little bit more information from you if we have time and if you don't mind. About what is next. What do you say after Are You OK? So if we can go through some of those, that would be wonderful. So tell me a little bit about you. So you're the clinical support officer, a paramedic, and a peer support officer with Queensland Ambulance Service. What does all of that mean?
All right. So, well, I'm Torrin. That's an easy one to cover off.
Yes.
So I've been a paramedic for 14 years now in Queensland.
Yeah.
And through that time, I got involved in the Priority 1 program as a peer support officer.
Yeah.
So that is that's just pretty much looking after your workmates. Just, both being proactive with keeping an eye out for your colleagues, but also we get notifications when other paramedics and our emergency medical dispatchers are involved in complex cases and risky cases and that sort of thing, just to check in on them and see if they are doing okay. And we ask them, "Are you okay?"
Yes.
And then refer them on to other services. So we have our own in-house staff psychologists that we refer on to.
Beautiful.
As well as external psychologists that we use. So that's the role of a peer support officer.
Wonderful.
But as a clinical support officer, we're a very it's like a jack of all trades role. Yeah. So we're supervisors predominantly, but we're frontline supervisors. So we'll go out on road and work with paramedics and offer them coaching and advice in the field, and as well as doing a clinical governance role. So we'll look at trends in management and that sort of thing, look at where errors have happened and what can be done to improve it.
Yeah.
And I guess the biggest thing that our paramedics see of us is the face-to-face education. So we're the educators as well, the clinical educators.
Yeah. Wonderful. Thank you for that. So
cool.
We are, for our viewers on Facebook, as well as the attendees that we have for the webinar, can you give us a little bit more of an idea about, as a clinical support officer, a peer support officer, generally at the moment with mental health in the community, what is it that you guys are supporting the community with? How do you guys play a part of that bigger picture?
All right, so we will respond to not just O calls. So people who are in an acute crisis situation will make a O call and ask for help themselves. Yeah. But we'll also get calls from other agencies. So whether they be counsellors, psychologists, GPs, and the various services like Beyond Blue, to go out and do welfare checks on people.
Yeah, beautiful.
So yeah, we'll go out and visit these people wherever they are in Queensland, whether it be their home, their workplace. They could be people who are, homeless, and we'll go and visit them wherever they are, and just work in that acute setting to, I guess, do an initial assessment and diffuse any situation that might be happening right there and then work out the best pathway for them into the health system and getting them treatment. So we have a couple of services which have been recently introduced, which are great. We've got our mental health clinicians that work in our communication centres, and they're all mental health clinicians from Queensland Health, and we can call them up at any time. We've got a dedicated phone line to them, and if this person has already been through Queensland Health for treatment, these clinicians have access to their records and it can give us insight into what their previous history is, medications, that sort of thing. But the other side to that is we have a co-responder model. So there's two co-responder models, one with police and then the one with us, with the paramedics. So that's a mental health clinician, usually a mental health nurse who's worked in the Queensland Health setting, and they'll come out on road with a paramedic and they'll respond to mental health cases. So whether it be they'll see the case come in and they'll ask to respond to that case, or we'll have a paramedic crew on scene with a patient, and that crew will identify that this patient could benefit from that service, and they'll ask for that co-responder to be attached to the case. And a lot of that is, sometimes it could be quite a complex issue that the patient has that's outside the scope of the paramedic. Or the other side of it is, is there ways that we can support this person in their own home and set up referral services and that sort of thing for them without having to take them into the hospital setting, taking them out of their position of comfort, whether it be their own home, their own environment, into that very clinical setting of a hospital emergency department. So it's, being able to deal with them there and then and set up the right services for them.
That's fantastic. And it's really good to know for the people that are watching in terms of what those options are and what that support looks like, I think. Because it can be something that's very scary for you to call emergency services or call 000 about yourself or a loved one who's not coping. So I think it's really nice to know that there's a couple of different options there depending on what's going to be the best course of action for that person. So thank you for letting us know that information. The next question I have for you is, what would that process look like in terms of if I am concerned about myself, or I'm concerned about someone that I love, and I think, they've told me they're not okay, they've told me they're having thoughts of hurting themselves, or I don't know if they're going to be able to keep themselves safe. At what point is it appropriate for me to contact emergency services versus see their doctor? What is the line there for obviously accessing emergency services over one of those other helplines and things like that?
I think personally for me, and I'm not speaking on behalf of the ambulance service here, but in my own mind, if you're thinking, wow, this is the feelings that I'm having, or the feelings that my friend is having, seem quite intense, quite severe. Should I take them to the doctor, or should I call an ambulance? I think if you're asking that question, then you've already answered it. It's, an ambulance is the way to go. And we'd much rather come out and say, look, it's not the right time for you to go to an emergency department, but hey, we can put these systems in place for you, whether it be speak to one of our mental health clinicians or set up a referral for you through one of the services like Support Link. And we can definitely advocate for the person and give them advice. So never hesitate to call.
Wonderful. That's fantastic. Thank you so much. And when you guys do head out on site and you're sitting there with the person, whether they're at work or at home, on the street, no matter where that is, what does that look like? So if somebody was to call an ambulance, what can they expect?
So usually they'll get a paramedic, no doubt about it. Now, it won't always be an ambulance like your Mercedes van that you'll see running around the street. Sometimes you'll get a single responder. So we have our LARU units, which are a local area referral unit. So they'll be in either an SUV style vehicle or a little van. And their role is to go to these sort of patients and spend a bit longer on scene and talk to them rather than the acute crews that are out there in a hurry, get things done really quick and get moving quick. So you might get one of those and they'll be by themselves. There'll be a lot of questions when a person rings up, and the emergency medical dispatcher, the EMD, will look for certain risk factors as well in things that are being said in the call. So sometimes will ask the police to go with the paramedics, just predominantly for the safety of the paramedics.
Yeah. Because
one thing we've seen is quite an increase in violence against paramedics. So, those cases where there is an acute behavioural disturbance or any sort of inkling of violence or anything like that, they'll usually send police with the paramedics, and that's just for safety.
Yeah.
So whether it be a single paramedic or a paramedic team, so 2 or 3 paramedics will turn up and we'll do just like going to your GP. It'll be that getting to know you chat, what's been happening, how you're feeling today. We'll usually do a baseline set of vital signs, so things like your pulse, blood pressure and that sort of thing, just to make sure that there's nothing acute physiologically that's happening that we need to deal with.
Yeah.
And then we'll just work out where we need to get you to and how we can help you out.
Wonderful. That's fantastic. Thank you, Torrin. And I think the biggest one for us as well, because it is Are You OK Day, and the theme, the tagline, the focus of this Are You OK Day is that there's more to say after Are You OK? And it's really about having ongoing conversations with people. So what's your tip for the people that are watching today or that are watching this in the future in terms of what can you say after you've said that initial Are You OK Day statement?
I think the biggest thing is being genuine with it and being ready for when you ask someone, are you okay? And they say no, how are you going to respond then when they say, no, I'm not okay? Yeah. Because you'll see that, are you okay? Yeah, I'm okay. And then someone says no, you're like, oh, what do I do now? So be ready for that no, and have something that you can do for that person, whether it be, hey, can I get you a cup of coffee? Or is there someone you want me to call for you?
Wonderful. That's such great advice. Thank you so much. And I think really highlights what why we're doing what we're doing today is, it is that when they say no, then what? We're so used to people doing the obligatory, no worries, I'm fine, it's all good. But more and more we're wanting to encourage people to say no if they're not. So I think that's a really, really good point. So thank you so much. Is there any other information, anything else you want to add for us before you head off?
I guess, look, the sphere of mental health for paramedic practice is something that's only really started being looked at recently. And I've just stepped out from a training session that we're doing regarding mental health. So it's something that's evolving, and I see it as a big area for us in the future. So knowing that and putting that word out in the community that these services are available and they're going ahead leaps and bounds, it's really good to get that word out there and let people know that we are there for them.
Most definitely. And I think that's been really helpful, you letting us know about some of those other services that paramedics have access to. It's not just about calling an ambulance and somebody having to go to hospital. That there are those other options there depending on what's going to be the best for that particular individual. So thank you so much for your time, and thank you for interrupting your training. Very, very much appreciated.
Thanks. And I don't mean to be rude, but I won't be able to hang around for the
No,
rest of your session.
We don't worry about it at all. You head back into your training. Thank you so much, Torrin. It's been an
Awesome.
absolute
Thanks for
pleasure.
having me.